Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the MyoHacker Podcast is your guide. Hi, I'm Karindy, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer. The content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. I am delighted to say that today, Allison Massengale, my dear friend, she is here with me to read some questions. We might just get through one question from followers and listeners, and we're just going to dive in. And this way, it's more for me. I get to actually talk to somebody. I love to do that versus talking at myself. So Allison's going to read this off for us, and we're just going to dive into some airway answers.
Okay, so she says, I'm wondering if you have any provider recommendations or thoughts on where I should start. I'm continuing to struggle to understand why my child with severe open mouth posture and mouth breathing has very few symptoms of dysregulation, while my younger two, who now mostly nasal breathe after CFT work, continue to develop more and more symptoms. We're specifically struggling with nighttime incontinence, disrupted sleep patterns, nightmares, headaches, and swollen tonsils. It feels very overwhelming. Presently, it feels like a mold or environmental response, but then that leads to the questions, why are their nervous systems responding this way? Why are they not able to move through and process this? Why at such a young age are they already broken? I just don't know the right path to go down, functional medicine, neuropath, etc. And I feel like I've tried a lot of things at this point, but they aren't improving and I don't know where to go next. In fact, my 6-year-old is to the point his inflammation has worsened to where he's choking on his tonsils and uvula. I'd like to avoid surgery as I feel like that's not correcting why they are swollen. But if I can't figure it out soon, I feel that will be our only option.
This is such a deep and profound question. And I think I just want to applaud the mom who sent this in, because clearly she is looking at everything from such a systemic, holistic viewpoint. Like she understands that if you go in and you just do a surgery or these things, that we're not necessarily addressing the root cause. And I love that she is aware that one child has responded differently to interventions than the others. And this is where so we're going to talk about some ways to determine like what path to go down next, if any, because you can tell just based on her questions that they have already done a lot. I expect based on this question that they've done a nutritional diet-based approach to reduce inflammatory foods, that they've already done a body work approach, which is CFT, craniosacral fascia therapy. And they have seen some changes, like some kids have seen changes and then others not so much. So let's break it down. I'm going to go into that first part of the question. So she's continuing to struggle to understand why her child with severe open mouth posture and mouth breathing has very few symptoms of dysregulation. That actually, I had another question that came in today from a provider who was like, okay, why is it that sometimes a patient might present with symptoms of ADHD, hyperactivity, anxiety, like more of a neuro presentation with their airway concerns versus another child who does not? Like sometimes you'll see that and a child can be walking around and their mouth is wide open and they're happy and they are connected and their attention is fabulous. So there is a lot to talk about here in regards to just the nutrigenomics impact. This is where we're looking at the physiology of where we came from and how we're responding to our environment, how much that can be having a physiological effect on the body. And this can be a kiddo who maybe they have eczema. Maybe you see that open mouth posture. Maybe you see these things, but they're able to attend. They're able to push through that. I have seen so many individuals who actually don't have ADHD, don't have those signs of hyperactivity and inattention, clearly have airway issues. But when we get into adulthood, that's when we start to see more of, and I'm not speaking this into the child who's not having these issues. I'm not saying that they will have this problem, but sometimes what can happen is they might have problems later on that they're not showing any symptoms of yet. So that's where we might see more of that increased depression or increased anxiety. But this kiddo also might not have that at all. They might actually have these airway issues, but they are able to generate, let's just talk about nitric oxide. Sometimes physiologically, we are able to create more nitric oxide from our diet, from what we are eating, when maybe we're not breathing appropriately and we're not getting that nitric oxide through nasal breathing. Like that's one of the reasons why we see individuals with signs and symptoms of ADHD is that nitric oxide imbalance. They have a ton of oxygen, but not that nitric oxide. This kiddo might actually have a microbiome that is supportive of what they are eating. And even though they're not getting this airway version of nitric oxide, they're getting it a different way. So it could be that. It can also be that while they are not having, I actually, seeing this question, they have a severe open mouth posture. Like they're already adapting in a way that works for them. You know, it's if a kiddo has their mouth and it's just barely discreetly open and you're like, did I catch them? Are they breathing through their mouth? Are they breathing through their nose? That kiddo is they're not really sure what's helping them. This child whose mouth is wide open, he knows when my mouth is open, I'm breathing great. This is, I see a lot of kids that it's like, well, like I would want to know, is he sleeping on his stomach? He's probably on his tummy, mouth wide open, and then his tongue is forward. It's not dropping back and blocking his airway. I don't know that, but I see that a lot in these kids that they know they have amazing sleep when they do this. And because he's supporting himself with that nitric oxide exchange, it's helping him. He can also then have a little bit more of that vagus nerve tone in other ways so that his heart rate variability is phenomenal. And in children, it should be anyways, but he might have more vagal tone because he's singing and humming all the time. He has found ways to move his body that are calming to his nervous system, that are grounding to his nervous system. If he's jumping and digging and giving himself those inputs, he's going to be more aware of his body versus a child who has a mouth that's closed and is breathing through their nose, but is moving minimally and is sedentary and seated in a desk upright all the time. So
right. So you might be seeing those differences when you see a kid that maybe their body, their physiology is different, but they're also maybe the way that they're living their life is a little bit different too. I know you've talked about how you would run on all fours and that widened your palate and widened it more than your siblings. So maybe he's compensating in other ways. And that's why she's not seeing the symptoms in him so much.
Yes. And often some of these kids, they can be quirky. Again, I don't know the personality or anything else other than these questions right here about this kiddo. He might have just kind of a quirky bent to him, and he is figuring out that way to regulate and be present and connect. He might be able to just dial into that connection a lot faster than the others. And sometimes we'll see this that you might have, from a genetic standpoint, one side of the family is more predisposed to having dysbiosis, or the gut is more permeable than the other side of the family. They're like, they got a stomach of iron. They can just eat all these things and it's fine. And then the other side, it's like, oh man, they get knocked over when they have things that the other side of the family really could have and not blink over. So we can have some of that, where maybe the other two siblings, again, this is, I don't know a lot of what is happening as far as even the age difference. That can make a big difference on what is happening from, mom's mitochondria and just even, the age of the sperm, that can make a big difference in things. And, we don't even have to go into that, but you can have factors that are changing a little bit of the presentation is adapting to what they're experiencing internally. So let's say she said, presently it feels like mold or environmental response. So I think of, I was actually talking to an amazing pediatric neurologist last week, and we were talking about a case that she saw. And this patient, flew all the way over from Vietnam to see her. And in this case, they literally had seen everyone. They had done everything and done all the testing, all of this stuff. And the only thing that really came up in his, and I'll share, he had been verbal, had been, as she said, quirky, but then really he within like 3 months became nonverbal, was rocking, was just like shifted. This was a different kid, completely dependent, so many things that it was like, what just happened? This is beyond severe autism. Like, what has happened here? And so they reached out to her in the labs. They found that the only thing that was even kind of there was a little bit of mold. And she was like, honestly, anyone who lives in Houston is going to have this much mold in their system. Like, do you really want to treat it? But the dad was like, yes, we want to treat this. Absolutely. Let's do whatever we can. So she was like, okay. And she truly didn't think it was going to make a difference because she sees these levels of mold in children all the time. And it is what profoundly changed him. And he got back that independence. And like she was talking about, she has such a large Vietnamese audience now of patients that literally fly from Vietnam because they have experienced and seen this quote unquote miracle. But like she talked about, she was like, it didn't make sense, but she knows the protocol that they did, and she knows exactly what it was. And his body should, like I say should, quote unquote, should have been able to tolerate that amount of mold, but sometimes it just can't. And his could not. And with whatever that increased exposure was, it was too much, and it sent his neurological system just over the edge.
Yeah. I've heard people talk about like kind of like a bucket. So it's like once your bucket gets full, then you start experiencing those symptoms, and everybody has a different size bucket, right? So your bucket might be really small. Sorry for you, and me. So, it's like, okay, yeah, we can eat those foods or experience that mold. And all of a sudden we're experiencing all these symptoms. And some people have a really big bucket, and it might be within the same family, right? That you're seeing those different size buckets. But once that gets full, then it's overflowing and you're in trouble.
Absolutely. I mean, and that's, I can think of myself, if I'm in a place where my inflammation due to a bunch of things is down, I can actually have a little bit of gluten and I'm fine. However, if I'm inflamed, if I'm not sleeping well, if I'm, a ton of things, just busy and distracted, I'm going to have a rash on my face the next day. It's just like, so we can have those intermittent flows of what is happening, what is affecting our nervous system. And then we can have these bigger picture effects where it's like, okay, this is not going to ever be something that can be a part of your diet or part of what you're doing. So I will say that first, I would really want to look into the gut permeability of those younger kiddos, especially so where are they not able to move through and process this? That is detox. So those detox pathways are stuck. And it can be that older kiddo is, even though he's not breathing great, his detox pathways are just more efficient and he is able to clear them. And so while he might get toxins, he might get this stuff that he's breathing through his wide open mouth, he's okay.
How would you look at the gut permeability? Would you talk to a nutritionist? How would you do that?
So I'm going to be very specific and say that I love referring out for the NeuroWell plus Nutrigenomics panel in regards to this, especially when they've done other things. Maybe they've already done a GI map and they know exactly what's going on there. And that's, a gut zoomer. There are different types of tests, but they know, okay, what is the beneficial? What do we have in the gut that is good? What do we have that is not? And how have they treated it? That can be really, really important because as we see, when we have that permeability, that's where they're getting irritants in the tonsils. They're getting stuff in the adenoids. And instead of it staying there or getting cleared through the lymph system, it's causing neuroinflammation. So that can be, it is exiting the tonsils and adenoids, but it's going somewhere else. That Dr. Krupstadt has talked. She's an amazing pediatrician here in the Houston area who is a functional medicine pediatrician. And she talks about that's in part why she wants to look at tonsils and adenoids, because you can have so many things that are festering in there in that tissue, even if it's not enlarged, but that can actually cause inflammation in the brain. So, and that they do different swabs, different tests, and followed up with EEGs and other exams. But a big part of it is just symptoms. Okay. Are we getting relief in symptoms when we treat it this way versus that way? And especially when you have multiple kids who have significant issues going on, we have to figure out what's the way that we can treat this most cost effectively. Sometimes we're going to have to hit it kind of big and expensive right at the beginning, because that really helps to lead the way of where do we go. And that can truly, truly help to understand, okay, we need this differential diagnosis of, is this a mitochondrial disease? We see so many kids nowadays that have reduced mitochondrial efficiency. Basically, the electrical signaling within the cells, it's just low. They're just low voltage. They're not really generating that energy they need to propel themselves into wellness. And these are the kids that I see, they do really well with the grounding, with movement, with body work, where people are facilitating that movement. They've done CFT. So we'll talk about body movement methodologies that they could consider, but red light can be really huge with helping them hear. But it's so key that we support the gut and find out if the gut isn't healing. We need to understand a little bit more of why. Like I said, that's where we go into, is it a methylation issue? Is it a detox issue? Is it autophagy? Like what is really getting stuck along this process to help them really move into health?
So if they do the panel, will that give them a direction of where to go and which doctors to seek out next?
That's a great question, because often it's going to, it does look at detoxification. I might skip one or two, but it looks at detoxification, methylation, autophagy, mitochondrial energy, like production there. It looks at metabolism, like markers for hormones and kind of where that is at. That is something, because we're seeing with all the plastics, with all the things, these toxins, goodness gracious, we have so many that hormone disruptors now that these are changing things. I mean, I know we talk about this, you and I talk about this anyways, how we're seeing puberty is younger and younger. Yeah. And this is something that has changed within, generations that hadn't changed before.
Right. Okay. So it sounds like that really is going to cover a wide range. So that should really give her some information then to seek out other doctors or to be able to bring to her practitioners right now and say, okay, these are some issues. So if it's the mitochondria or if it's the gut, just to kind of identify. So that should be helpful for her.
Yes. Which, by the way, I want to point out, so I refer regularly to Danielle Mitchell with the Cognizant Group, and I'll provide her link below. And she is the one who originated, she put together this specific panel based on, really was over years of us, not just me working with her, but she was seeing we needed more neuroinformation with a gut overview, looking at a lot of these markers and then giving action plans for it. So she created this. But if you're a nutritionist or a mom who, let's say you're a nurse practitioner or a PA or things like this, you can get trained in this and bring it into your practice. And I want more people to, because we need providers to be talking this language and to be aware of this. And it makes such a difference, because this is where I will work back and forth with Danielle over, okay, this is a case where they need me. They need airway. We need to be moving the tongue. We need to be breathing through our nose. We need to be doing oral muscular retraining, desensitization, all of that. And then there are times when I'm like, we need more of a cellular level support. This is where we need, like I said, that mitochondrial energy. We need something else. Sometimes it can be more structural. We haven't gotten into this yet. So CFT is wonderful for a soft, gentle fascia release of the body. And that does change hard structures. However, as we get older, sometimes, let's say that palate is really narrow and we're needing more of a definitive structural support. This is where I love to refer to chiropractors who are trained in Dr. Martin Rosen's program, because he does the cranial work where it actually is physically moving bones. And sometimes that can be it. Sometimes we need a little bit more of a structural bone shift to occur. And that is its own intervention. I would, in this case, say I would say, look at the NeuroWell plus nutrigenomics panel and look at getting into a chiropractor who is trained in this technique to see if we can change a little bit more, not aggressively, but it's different from CFT. I'm a CFT provider, so clearly I love it. I'm biased in it, but I see that there are times that I have to refer out because I'm wanting something a little more specific, and we're under a little bit more of a time crunch to get that in. Especially I see, a lot of kids, they'll have restriction and tension in the floor of the mouth, and it can be related to a tongue tie, and it can be related to how they're functioning. And that radiates back around the magnum foramen. So the base of the skull, where, that we have that giant hole where our spine and all the stuff is going through. And that tension can actually be just around that and tightening and reducing some of that just neurological information. It doesn't mean that they're paralyzed or anything. It's just there is strain. And so sometimes when we do CFT, we can really open that up and we can get a shift. Other times I need a chiropractor to go in to do that sphenobasilar synchondrosis adjustment that changes the sphenoid and the occiput and how those bones are communicating from a bone standpoint.
Okay. So chiropractor, the panel. Any other suggestions for her?
I think she's probably doing red light, doing sauna, doing dry brushing. So these are cases that I do like working with a functional nutritionist who is going to be nuanced about, we want to support detox way before we start bringing on methylation. Because if, let's say these kiddos, we know that their vitamin D is low, their B levels are low, and we start supplementing with those things, we might see negative behavioral outcomes, like they get worse. And that can be because instead of clearing what they already have, that's kind of sludge and toxins in their system, now they're just building up more because they have given their body, they've given it some of that juice, that energy it needs through the vitamin B and the support there. And then they've increased the hormonal activity through the vitamin D. But suddenly they're not clearing this increased activity that has its own trash, because cellular function creates waste and we need to clear that. So if they are not first clearing those pathways and getting detox really opened up, we might see that something that should help them make them worse. So that's where it can be very nuanced. And that is out of my scope, guys. This is just me talking about what I've seen really help patients again and again. And that's why you want to work with a practitioner who understands these things, who's really well read and well experienced in addressing these concerns. I want to share something that has been amazing for me. And honestly, I think it could be for you too. If you've been around for a while, you know I have ADHD, and finding ways to support my focus and mental clarity is non-negotiable. That's why I'm obsessed with Danger Coffee. Unlike regular coffee that sometimes leaves me foggy and jittery, Danger Coffee is tested and proven mold-free. That means no hidden toxins hijacking my brain power. Instead, I get the clean energy boost I need without the crash. But here's the kicker. It's more than just a clean coffee. Danger Coffee is electrolyte rich, which means it supports my adrenal health instead of depleting it. Plus, it's remineralized, which supports cellular function and even the mineral density of our teeth. As a myofunctional therapist, you know I'm always thinking about oral health. Minerals are key to keeping our teeth strong. So, if you're looking for a coffee upgrade, give Danger Coffee a try. And because you're part of the MyoHacker community, you can save 10% with the code MyoHacker. Just head on over to dangercoffee.com and use the code MyoHacker at checkout. Try it out and let me know if you feel the danger edge. I do want to talk about he's choking on his tonsils and his uvula. So that there are times, and I'm just referring back to that question that was a part of it that she mentioned, there are times when it can be structural. You can have these structural changes. And I'll just give case in point, my own 2 children. My oldest son, we were able to do the ALF, body work, diet, a ton of things. And he was scheduled to get his tonsils and adenoids removed. And I worked with an amazing chiropractor. This was years ago. And she was like, give me 8 weeks. And if you haven't seen those changes, then you know what? Go ahead and reschedule the surgery. But let's see if we can get it to shift. And goodness, it was amazing. We had so many beneficial changes and it was beautiful. Then I have another son who we did very similar treatment approaches, did the same oral appliance, the ALF, and then really just kept running into issues and again and again and again with it. And finally ended up going to the ENT where he did a scope and saw that he had just structurally very different tonsils that were very long and went, I mean, really down almost to the epiglottis. Like they were very long and got very thick, really low down in his pharynx. So even though we were doing so many things to support his detox, the structural shifts of, so that his tonsils, I promise they were not that big at some point, but they did get big. And then his, instead of getting wide and really being where you can visually see them in the back of the throat, which is, you know, as a myofunctional therapist, I'll look in and I see these big tonsils back there. Instead of his getting wide and big in that way, they went long. And then with gravity, he had just a lot of toxin buildup at the bottom. And so for him, it truly was, we do need to get them out just because of it disrupting his sleep so much. And so I will say for me, like this is a huge part of this conversation. I know people are going to hear that and hear me say that and judge me. And I'm probably going to get emails and I'm probably going to get things and you can unfollow. That's fine. That's fine. I ended up needing to do what was best really for my son. And in that case, it was something that I was like, oh, this is a part of my identity that I'm able to help problem solve with families and reach a conclusion and get them out of this without this intensive, aggressive medical intervention. But then I truly felt just this piece of, no, really now I can absolutely understand and empathize and sit with families who don't want to do this, don't want to do it. But if you really have done everything else that you can, okay, sure. Are there other things we could have done? Could we have flown to Utah and done? Sure. There are tons of crazy things, but from a financial standpoint, from a time standpoint, from just the family dynamic standpoint, could I do those things? No. So in that case, helping my son improve his health, really, it was very important that we proceed with this surgery, with this intervention, and we do so in a way that supports his detox before the surgery and after, and that it is very intentionally done. So you better believe we were doing all the things to support, because I didn't want him to be under that anesthesia. I didn't want that to really shift, his neurochemistry and neurobiology. So we were very intentional about supporting him. And that can be its own, we should probably do a podcast on that, on how do you support when you're like, okay, we are going to do a surgery. We got to head. Yeah. So what do you do when you don't want to? What do you do? And that's a huge part of it too.
I think it's important to say she probably should work with an ENT and have them look at it. And, if she hears one answer, she might get a second opinion. Because I've heard you say, it kind of depends on your ENT if it's somebody who's airway centric, right? So if she can find an ENT that's been recommended by somebody else, doing that would be helpful. But also just getting that information for them to actually look and see, is there a structural issue with her son? And that's why it's becoming such a problem.
Yes. And just... that can make a huge difference. So I will also say, two other things that I kind of mentioned here. So the ALF, I do love that appliance. Not everyone uses it the same. So I'm not going to just recommend the ALF appliance, but there are practitioners who use it as an extension of the body. So the brain actually thinks that the ALF is the tongue in the palate. And so it promotes lymphatic drainage. This is why often patients will get an ALF placed and then they're like, suddenly I have all of this sinus stuff and I'm gagging on things. Like I do see that sometimes where it can be this deluge of sinus stuff that they are draining and clearing. But we want that. We want to get that out. They can also do oral lace, or depending on the age, it can be baby lace, which is a specific laser frequency that can go in the back and can help with collagen production and hyaluronic acid and can really move things through and help with getting that drainage started. That can make such a difference. You know, we talk about the nasal hygiene and all of these things pretty regularly. So incorporating that and then the chiropractic adjustments to get those eustachian tubes opening and draining, getting that palatal input from those adjustments can make such a difference. And then something like the Flow Vibrate or even a Flow Presso experience. You know, like I said, one of the amazing neurologists, she's here in Houston, she has a Flow Presso machine, which is a full body lymphatic machine for kids because she sees tonsils and adenoids as such an issue, an airway issue for their neurological function, that she's like, I want to support their lymphatic system. So those are all things that can hugely support shrinkage of the tonsils and adenoids and red light, sweating, getting outside, and then connection, laughter, being in a nervous system place of connection and joy. Man, your body wants to heal when it's in that place versus if it feels like it needs to hide and hold and stay small. That is not a place where we heal.
Yeah. So the ALF and is it baby lace? Is that what you said for the laser?
Or oral lace. Yeah.
Oral lace. Yeah. Those can be accessed through an airway centric dentist, right? So
very specific ones. So those are going to be, so both those technologies were created and sort of founded by Derek Nordstrom. So he has different trainings and different providers who are trained in them. So you can go, you know what, we'll provide links of a couple of those places. And then a lot of it is honestly, you kind of have to find out, like, are there other providers who are trained in this? This is in part why I'm doing this podcast. There are not enough providers trained in these interventions, and we need more providers trained in it. Okay. It takes time and it's very expensive. So yeah, I get it. But providers, we need you. We need you, need you, need you. So guys, if you are in a place and you're like, I need a provider who does this and I have an amazing dentist, they don't do this, please share this podcast with them. And I would love to connect with them and convince them to get trained in these things. I am not paid for this. There's no way that I'm like making a kickback for patients doing these treatments. I just wholeheartedly have seen that it can make such a difference. And we just need more people to do this so more families have access to these treatments.
Right. Before we go any further, I heard this mom just overwhelmed, she emotionally is struggling. And she's said, why at such a young age are they already broken? So I feel like you are so good about responding to that.
Oh, man, I would say I want her to listen to the episode that I did with Carrie Woods, who from Be Wholly Healthy, who is a phenomenal example of how to be present with your children when they are going through something where you need to be there to take them to these appointments. You need to help them navigate this healing and get through this process. But we also do not want to stamp these children with an identity of, I need to be fixed. Like, that is not what we want to impart. And I know this mom doesn't want to impart that either. But as parents, we can get, this is where it can get crazy making when you go down the airway research rabbit hole and you're learning so much and, biohacking is the same way. And you're like, oh my gosh, this, that.
Yeah, there's so many options.
You can really get stuck into seeing what is wrong and what needs to change. And it can take up your whole vision and everything you see about your child, even about yourself. And that, I promise, is not how we are made to live. And these kids breathing amazing or just pushing through it, whatever, however they are showing up, I promise that they have a reason to live themselves that is bigger than this airway. So we are here to help them, but it is not a sign of have we failed? Have we succeeded as parents? If our kids are healthy, if our kids are I've heard this so many times that it's like our children are not a report card of how we are doing as parents. And it feels like that. And people
it feels
actually,
like that.
People will say that they are.
Yes. I mean, taking my kid to the dentist and having them have cavities after working so hard, it does feel like a report card. You feel like you're being judged. Yes.
Yes. And so I am taking everyone's report card and shredding it right now. Okay. Just take that and shred it. And let's support connection instead. And fascination and joy. I bet there are amazing ways that these kids are creative. Amazing ways that these kids have strength and curiosity and tenacity. When we are focused in on whatever this acute health issue is, we lose sight of that and we need to pull back. We need to physically move our body and get some distance and see, okay, let's take a breath. What is it that I am thankful for about my child? I want you to write down 5 things that you are thankful for. And that is what we're going to start focusing in on, and truly start focusing in on what are some airway things that you are thankful for about yourself. I'm not trying to make this a self-centered thing, but what we focus on, we get more of. We've all heard that. And so if we can really look for what are the positives, what are those moments, and I'm not trying to just paint over this. Okay. I feel this pain and I hear it and I see it. So I see you and I hear you, and I want you to right now take a breath and take a step back and focus on just really what you've already done that has been amazing. And I want you to write a letter to yourself that is thanking you for how you've shown up for your family and how you have really changed the trajectory of their health. And I want to say there is no way for you to know how much of a difference you've already made. You can only see like all these symptoms that are sticking on, that are not going away, but you don't know. You don't know how you have saved them from something that was coming, but because of you intervening, you have helped in a massive way. So I want to say bravo, well done. Good job for not giving up. You reached out to me, so I know you're still working on this. You're still trying, and I just want to give you a hug and let you know, like, you are doing amazing. Let me know. What are your questions? What were your thoughts listening to this podcast? What are the struggles you have had? What are the ways you have felt judged? What are the ways you have lost that creativity and that inspiration in this airway journey? And guys, I want us to really think through, how can we get back into that? What is it that inspires you? If nothing else, I just want you to comment or send me a DM and let me know what is one thing that's inspiring you this week, and let it be quirky, let it be fun, let it be independent of what anyone else thinks. If you have listened to this and you're thinking, all right, I need to be working with a provider right now, I want to connect, I am going to, we'll link in the show notes to providers that from chiropractors who do the specific techniques that I was talking about to individuals who are trained in the NeuroWell plus nutrigenomics panel. And we'll share those. If you need myofunctional therapist who can help with getting that tongue up, getting that tone to shift, getting that drainage of the lymphatics, of the tonsils and adenoids through the tongue movement and through how we're breathing, we'll share links to providers that you can find that way. So I cannot wait for you guys to get connected with all these providers, because it really does take a team. And I want you to have these resources. If you know that right now you're like, I can't jump into these teams, I can't do this, I would love for you to participate in MyoMagic at Home. It is a fabulous just foundation to airway and myofunctional health. And just by doing those activities, those exercises, it can make such a difference in getting that drainage of the tonsils and adenoids to start to ramp up and to help with that. So please consider that. MyoMagic at Home. It's on my website. Lastly, if you're like, I really want to pick your brain and talk to you about my case or a a patient that I'm working with, feel free to reach out. We'll provide the link as well on how to work with me from a consultation standpoint. You can do that, and we can just talk through this of what is going on and really go, okay, what are some ways that you could troubleshoot some things, and what are some things to discuss with providers you've already seen, or how could you troubleshoot it differently?
You are really amazing at troubleshooting. I love how you help families figure things out. Maybe they've been seeing practitioners before and it hasn't clicked. Nothing has really broken through, and they talk with you and they come up with a new way to do things, or you challenge them to get out of their seat and try the exercises out of their chair. And there's these breakthroughs. So, if you need help, I'm like, Karindy is your girl. So seek her out.
Thank you. I hope you have enjoyed this episode of the MyoHacker Podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at MyoHackerSLP for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as MyoHackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.